First, a very warm welcome to all our viewers around the world. I'm Suzette Kox, the Secretary General of the IGBA, the International Generic and Biosimilar Medicine Association. During this week, we host a Global Biosimilars Week, which is a social media campaign which raised awareness about the important role of biosimilar medicines. And in the interview today, we will focus on the important role of biosimilar medicines in achieving equitable access in cancer care. Now, I remember in the very early days of the biosimilars, the medical oncology community in Europe acknowledged the prominent role these therapeutic options could play as what they call a must-have weaponry and a catalyst for equal access in cancer care. So we thought that it would be very important to interview you, Cary Adams, the CEO of UICC, the Union for International Cancer Control. Thank you for being with us today, Cary.
It's a pleasure, Suzette. Thank you for the opportunity.
So first, I would like to, before we kick off, is that you introduce yourself, as well as UICC and its work, and particularly in cancer medicine, and of course, ATOM, the Access to Oncology Medicines Coalition, which is a fairly new initiative by UICC.
Yeah, sure. So I've been the CEO of the UICC for 13 years now. We're a team based in Geneva, in Switzerland. We're a non-government organization of 42 people, but importantly, we have 1,200 members, organizations around the world, cancer leagues, cancer society, patient groups, etc., in 173 countries. And we're actually celebrating our 90th birthday next year, so we'll hopefully have a few celebrations. You will be invited, Suzette, do not worry. We have a responsibility for our membership to cover the full spectrum of cancer control, from prevention, looking at risk factors, encouraging, for example, the reduction of tobacco use around the world, to the use to early detection and screening, treatment and care, including palliative care as well. So the full spectrum of challenges that we face to reduce the cancer burden in the future. And 2 years ago, our board became interested in the issue of medicines availability, particularly in low middle-income countries, where we had seen reports coming out of the WHO, the World Health Organization, suggesting that less than 50% of the essential medicines list, these are the recommendations from experts around the world, of drugs, medicines which do work in the treatment of cancer, that only less than 50% of those were available in low and middle income countries. And so UICC, with many of its partners, looked at how we're trying to solve that problem and considered whether there was a different way in which we could address it, in using all the experience and knowledge that we have collectively across our community, but also across other communities around the world who have a passion about the need to get medicines to patients at the right time.
Yeah, well, it's a very, very ambitious project. And as you also know, that IGBA is a recent partner of the coalition, and we are very excited about the way you look at it. It seems a new, different way of tackling the access to medicine challenge. Can you talk a little bit about this approach, which which you are about to develop, and together with the partners, and get an insight of that different way of looking at access to cancer medicine, and in particular in low and medium income countries?
Yes, sure. So I think we can all look at the current models which exist for getting generic biosimilar medicines, patented medicines as well, to lower and middle income countries. And there are some excellent, outstanding organizations that have been operational in that space for years, the likes of the Max Foundation, Global Hope, working in Africa, and others. But their model has relied very heavily on a relationship with a single manufacturer, or a couple of manufacturers, through their chain of supply into the countries in which they operate. And invariably, the model is operated on the donation scheme model. Now, this is not obviously a sustainable model in the longer term. And whilst there is a proliferation of these very vertical solutions, which are effective first target populations of types of cancer like childhood cancer. What we're not really doing is addressing the bigger issue, and the bigger issue that 70% plus of cancer deaths occur in low middle income countries, and 70% plus of the growth in cancer cases in the next 20 to 30 years will be in low middle income countries. So the current models, whilst really effective, aren't the solutions to such a large problem that we face and the growth that we anticipate in the future. Now, the challenge with Atom was to say, could we bring all of those individual organizations together as a collective? Could we identify a group of countries in which we can all operate together, either operating there at the moment or maybe 2 or 3 organizations working there with the UIC members in tow as well, and talk to the manufacturing companies and say, look, instead of doing a single drug for a single disease through a single group in a few countries, could we open the discussion with you about more sustainable ways in which we can get your medicines into those countries of your choice and of our choice as well, and give you the full range of options to include extending your donation schemes, perhaps doing tiered pricing across multiple countries, and even the new thing on the table, working with the medicines patent pool for medicines and new medicines coming out in the future to do a rather quicker access to those medicines using a voluntary license process through the medicines patent pool. And we put all those 3 options down on the table. Now, what's been interesting is that companies responded very positively to that. So we've just had our first voluntary license, nilotinib, which has gone through the MPP process and will be made available through them and through manufacturers in the future. So we are seeing progress in the right direction, but we want to see more as we go into 2023.
Yeah, I think this was really a great news. I was in Geneva when it was announced by the medicine patent pool, and I think it's really a paradigm shift, if I can say. We talk here about biosimilar companies because we are in the context of the Global Biosimilars Week. And as we also know, there are more and more biologics in the cancer care. So you would need biosimilar companies to come on board. So how do you see their role here, and how do you reach out, and how can we make sure that that they know what is ongoing and they join the coalition in this very ambitious project?
Well, I think the biosimilar companies face the same challenges as most other companies of medicines, getting medicines into low middle income countries. And that is that, no, it's difficult to get registration. The supply chain management is difficult. The diagnostics and pathology is difficult. The funding is not necessarily there. The competency and capability of the individuals who are part of the oncology health sector are not there either. So what Atom does is 3 prongs. First of all, it'll work in countries to improve the ways in which medicines can be received and used in those countries, which is why it's so important that some of the partners of the Atom Coalition are ASCO, Project ECHO, all of the potential organizations that can train, support, and help those countries improve the way they can manage the medicines as they come in. We're also working with WHO to see how we can improve the way in which we can get medicines registered across Atom countries as a whole, instead of one by one. And we're also looking to see if there are ways that we can negotiate pricing so that companies, whoever they are, biosimilar company or other, who wish to get their medicines into Atom countries, can look at a larger volume of market volume or number of patients which will be affected by their medicine, but also have some assurity about the long-term commitment of those countries to the medicines in future. So overall, to some extent, we're creating a new market enterprise where we're trying to break down all those barriers which prevent companies today making decisions on whether they want to take their medicines into those markets. It'll take time. It's ambitious, you're quite right, but we really do believe that if we work collectively across, I think it's over 35 organizations now, then we can target low and low middle income countries and be successful in the future.
Can you expand a little bit more on the countries because I think there are 56 countries which have been selected or less. Can you just give a little insight about that also?
Yeah. So we focused our attention initially on low and lower middle income countries, and there's approximately 82 of those according to the World Bank's classification. Now, all of the partners existed, but in the first 6 months when we were forming and norming, we asked each of the organizations to reflect on those 82 and to come up with their recommendations on where they feel they could operate, either as a company or as an organization, where they currently have a footprint, et cetera, et cetera. Meanwhile, UICC did an evaluation of all those countries to see which ones had national cancer control plans, cancer registries, where we had strong presence of UICC members, or where we felt that there was a government that was inclined to support the ambition to improve cancer treatment in that country. That narrowed it down to just over 40 countries that we have identified, where we believe in a 10 to 15 year period, we could work in those 40 odd countries. Now, we can't do all of them at once, but you've already seen now the partners are operating in those countries are starting to talk to each other and see how they can work together and help each other in those countries. But we have identified about 10 countries across all regions where if we had sufficient funding coming through the next few years, we could kick off some pilot projects where we could work collectively in those countries to understand the dynamic of cancer treatment and care in that country, and then see what we can collectively do to improve the availability of medicines and their use by well-trained and qualified individuals. I will stress that doesn't stop any of the current organizations in the Atom Coalition doing the brilliant work they do today. So we're not waiting around for funding to turn up. Now, the Max Foundations, the Global Hosts, the BBGH, they're all working today on the ground, doing the work which they've been doing successfully. And hopefully they will be able to expand their work across countries whilst we're still waiting to find big funds to do specific targeted collaborative work country by country.
Yeah. So what is very important for the off-patent sector is that the model of operation is different than for the originator companies. So what they need to have is really competitive policy framework has to be in place. A big challenge are the demand and the economy of scale. So I think it would be great if we could sit together and discuss that, from the angle of the off-patent sector, which is different, because we all know that development is one thing, getting the registration is another thing. So the availability is there, but that does not need yet that all the conditions are there for also the risk mitigation for the companies to go into there and really can do. And the issue is also the continuity of access, which is very important.
The structure of Atom allows us to address those challenges that you've just outlined. The current models don't. They don't. So yes, we have now for the first time an opportunity to sit down with a collective group of organizations that have experience and knowledge of working in those countries across multiple diseases. And at the same time, we can address some of those barriers which you've outlined in terms of surety of volume sales in the future, funding, et cetera, et cetera. So this is where Atom is establishing a platform which can be designed to address the challenges that you see. We don't want to create another set of challenges. We want to provide a set of solutions.
I like that approach, definitely, because what we experience today, certainly from the off-patent sector, is that we have so many different requirements in different countries. For the biosimilar guideline, now we got a revised WHO guideline, and we will also issue a white paper this week. We have launched that. It is about how this guideline also should be implemented in a coordinated manner by the national regulatory authorities, in the sense that they have to review what are the requirements and all come on board so that we have the same standards in place everywhere. And that, of course, facilitate a lot biosimilar companies to go in a market or not. Also, the whole market setting, the policy framework which is in place and so on, I think we have to discuss further beyond the development and the marketing authorization, which is crucial, as I said before, but we have to sit together.
I totally agree. I totally agree. And if that's the one thing that we can in the coalition achieve in the next couple of years, then I think we will have achieved a lot.
So just to close this interview, I think was very inspiring. I hope also that it interests many biosimilar companies which have been taking part at the Biosimilars Week. So where can they reach you? Where can they get more information? And what do you think what they can do proactively to come along to reach this ambition?
Well, the information on ATOM is at the uicc.org website. There's a section there all about ATOM. It lists all of the current partners, and I think you can click through on the partners to see what they're doing. Or you can reach us directly by emailing atom@uicc.org. And I would welcome actually any organization that's listening to this or have heard about ATOM, I would welcome them to contact us and talk to our team so we can explore what their thoughts and views are, what their challenges are, and look and see how we can integrate them into the ATOM Coalition mindset and model. I've got to say, I've been really inspired by the fact that everyone we've spoken to in the last 12 months has really seen the opportunity and has come in and been an active player in our discussions. Everyone gets in and they're invited to be part of the discussion. We want to understand how you can play a role, what you want to achieve, and then we can collectively address the barriers that you foresee in getting your medicines to the countries in which we wish to operate. I had not met anyone in a company, organization, or a UN body who doesn't want to solve this problem.
Yes.
We all want to solve this problem.
Thank you so much. And thank you for your time and offering us this interview. Thank you, Cary.